We can always pray, but you go right ahead.
Okay. Let us pray. Lord, we're so grateful for this day and all the gifts that it offers. And we thank you for Sarah and the ministry of the CDCA. And we pray that you would bless our time of conversation tonight as we find ways to strengthen this partnership and offer the support to the people of Nicaragua that they might need to help them thrive. We are grateful for this time together. In Jesus' name we pray. Amen.
Amen. So is it me? Am I on? Okay. Let me get my screen share to work here. Oh, you've disabled me. You have to make it so I can screen share. There we go. Can you see that?
Yep.
Okay. So it's been a long time since I've been back in Davidson, but at least this is better than nothing, right? So I'm excited to be with you. So thank you for joining us tonight. And please, Robert, feel free to share this with anybody in the church or elsewhere that you want. If I make specific comments that are particular to Davidson College Presbyterian, then if somebody else listens to it, they can just deal, because that'll be what it is. So we wrote this script. Kathleen wrote this script and we put it together before Lent, but it really is very appropriate for Lent. So I'm just happy and privileged to be with you tonight. As the world continues to battle the COVID-19 virus and its new strain that is even more contagious, we are beginning to see a light at the end of the tunnel as vaccines go into people's arms. Societies worldwide who have used bandages to cover all their ills are watching the virus strip away those bandages, and instead of nice, healthy scabs covering a healing wound, we are finding festering, ulcerated wounds in our society, impacting those who live in poverty or on its edge. Aspects of our lives that make us feel secure and safe are stripped away by this virus. Food, housing, health, income, support. Add to the virus stripping of basic securities, the world in 2020 has also had to cope with more massive changes in our climate: hurricanes, droughts, floods, fires, tornadoes, rising sea levels, winter storms, and the list just keeps going on and on. The Center for Development in Central America, the CDCA, a project of the Jubilee House community, a US 501c3 nonprofit formed 40 years ago for service with the poor in Statesville, North Carolina, has been addressing these changing issues in Nicaragua for the past 27 years. Nicaragua is one of the poorest countries in the Americas and the Caribbean, and it's recognized as one of the most affected nations in the world due to climate change with the impact of others' carbon footprints. We understand the insecurities that those living in poverty deal with on a day in and day out basis. We have seen with our own eyes the devastation of climate change in this small nation. We have been and continue to work with people living in poverty through four main focus areas of our ministry. The first, sustainable agriculture to ensure food and cash crops for farmers of small farms and cooperatives in a way that protects the land, air, and water. The second, sustainable economic development to give work and income to those who struggle to feed their families. The third, healthcare for people living in poverty to secure consistent and specialized care for their bodies and their children's bodies and minds. And the fourth, education in farming, business, and public health, and to teach those who have resources about the realities of those who do not, about our global human family, in order to create a healthier and more equitable world. With climate change, sustainable agriculture becomes a shakier and shakier prospect each year. In 2020, Nicaragua was having a good year of rains and crops were going well until November, when Nicaragua was hit by 2 hurricanes in 2 weeks. Let me say that again. Nicaragua was hit by 2 Category 4 and 5 hurricanes in just 2 weeks. 2 weeks. And these hurricanes were named Eta and Iota because there were so many hurricanes in 2020 that names got used from the Greek alphabet. November is traditionally the beginning of harvest time for most crops here because the rains have stopped usually by that point. But instead, the crushed crops started rotting in the fields. Nicaragua lost most of its bean crop, the main source of protein for poor families. And without irrigation in the dry season, farmers cannot plant again until May or June, when the rain is expected to again start. We work with one small organic coffee cooperative on top of a remote mountain who lost their organic bean crop, their organic sesame crop, and their organic coffee crop was damaged. To what extent, they don't quite know yet. This coffee cooperative struggles year after year to stay afloat and to protect their land. Countrywide, most of the organic sesame crop survived. Sesame is a good cash crop for farmers. The organic agricultural cooperative with whom we work, CoProXNIC, helps the farmers obtain organic certification as well as process, ship, and market their crops to buyers in the US, Europe, and Canada. CoProXNIC runs a world-class sesame processing plant, giving full-time jobs to 42 people. With our help, renovations are constantly being done to the plant. Recently, they obtained equipment that will allow them, for example, to process a batch of sesame seed using 80 gallons of water instead of the 2,000 gallons currently being used. Together with CoProXNIC, we are searching for ways to be more ecologically and economically sound. One other major crop is organic peanuts. Peanuts are susceptible to fungus with too much rain, which creates aflatoxins in the peanuts. We will be able to see what kind of damage the hurricanes did when processing starts this next week. The hurricanes devastated the North Caribbean coast of Nicaragua. We had only 27 deaths because the government evacuated 100,000 people, vulnerable people, before both hurricanes hit and provided temporary shelter. But 3 million people, almost half the country, were affected, with $743 million in damages overall in 56 municipalities, with 5,800 homes destroyed and another 38,000 homes partially destroyed, as well as serious damage to public health clinics, churches, and schools. This government, even with its limited financial resources, is now spending a great deal on hurricane relief. They have pledged to rebuild every single home. And food prices are going up with the devastation of crops. The CDCA has also responded to the hurricanes thanks to generous donations and supporters like you. We've sent several truckloads of used clothing, hygiene kits, blankets, and food to the Caribbean coast as recovery is ongoing. And we've been coordinating with the Rotary Club of Ciudad Sandino, working with the local Moravian church to distribute other needed supplies and to provide bean seed for immediate replanting in the worst hit areas, using residual ground moisture to quickly eke out another bean crop wherever possible. And all the while, Nicaragua, like the rest of the world, is dealing with COVID-19. This nation has not shut down and its economy is doing better than most. Nicaragua has done an amazing job of keeping down deaths due to COVID-19. The National Health Ministry's official numbers of COVID-19 deaths are show it lower than any other Latin American nation, as reflected in these World Health Organization graphs, lower by a lot. And other unofficial estimates are also very low. We have had increases in deaths from pneumonia, but still not anything like our neighboring nations. Now in 2021, even with the ongoing virus and respiratory issues, unlike many hospitals in the United States, we have hospital beds and ICU space available. In Nueva Vida, a neighborhood of more than 12,000 people formed on the edge of Ciudad Sandino after Hurricane Mitch hit decades ago, along with our ever increasing patient load, we're also seeing COVID-19 cases in our Nueva Vida clinic, and we do not have testing abilities. Last year, we implemented strict pandemic protection procedures. Our doctors look like aliens, but all 3 doctors contracted the virus last year, and so we are careful. We check in patients outside. Patients sit or stand socially distanced and have to wear masks. Clinic staff wear masks and face shields. Every room is disinfected after every patient. For months, chronic care patients, the elderly, those with diabetes and hypertension, who are at high risk of mortality, received their monthly medications delivered to their own homes. Last year, we cut back on clinic services and even closed for 1 month when our doctors were ill. But with vaccinations going to wealthier nations and poorer nations like Nicaragua just now starting to get vaccines, we decided that together with program and community leaders, that the people needed our services and that we would reopen. Our Rotary has also been working, distributing hygiene supplies and setting up hand washing stations in parks and churches and schools and markets, public places. And thanks to generous international donations from Russia, the World Health Organization, and India, COVID-19 voluntary vaccinations began here this month. And I just checked, and the number is that there's supposed to have been 200,000 vaccinations given by tomorrow. I don't know if that's 200,000 different people or 100,000 different people with counting the 2 doses, but that's very good news. In addition to responding to illness, our Nueva Vida clinic offers services on special days of the week for healthy patients, such as EKGs for heart monitoring, family planning, including implants, and Pap screening for cervical cancer, ultrasounds for pregnancy monitoring and finding tumors, tears, and stones in organs. We provide vision checks and do pregnancy, infant care, and asthma education one-on-one with social distancing instead of in classes. We've also started public health education back up in smaller groups, also socially distanced, everybody wearing masks. Robert, a parentheses, this is the education room in that 3rd building where you were in use. Our boys and girls.
I think I saw them putting that tile down when I was there.
Right, I'm just trying back up. Yeah, the floor tile. Isn't it nice?
Looks great.
Our boys and girls support groups have grown, and it's particularly challenging to keep them safe and keep them learning, but we do our best. Our pharmacy has glass between patients and staff. Our lab tech is very careful with wearing personal protective equipment, as are our dental staff, who are probably at the highest risk. We give preventive care, dental care to the children that Orphan Network brings in from their feeding centers, those that are now reopened. Our therapist has been swamped with cases of trauma and fear from the uncertainty of the virus and with food prices going up. She's supposed to work half-time, but she also volunteers for 2 additional afternoons to attend to adults and children. And she also did telecounseling the month that we were completely closed. The cost of all the protective gear, the cleaning, the disinfecting, etc., it has increased our clinic expenses. We've provided masks for all our staff, including non-clinic staff, and requiring the wearing of them on all our properties. We have hand washing stations outside all our buildings and gates, Alcohol sprays and gels are at desks and workstations. We make our own bleach to try to economize, but keeping the virus at bay is costly. As we try to keep costs down, we appreciate all the help that we continue to receive from people like you. Caring donors like y'all have kept the work going. For example, in the beginning of 2020, the CDCA was just starting to host delegations and volunteers again after the political unrest in 2018, and then COVID hit. With the continuing loss of delegations, the CDCA again lost $100,000 in revenue and $50,000 in donated medicine and medical supplies formerly brought in by volunteers, those medical brigades that Robert was talking about. With COVID, working from home, we also were not able to travel anywhere to speak about the work. I couldn't come see you. Trips which often brought in $60,000 a year. But our educational work continues. We're grateful to have learned to educate and speak in alternate ways, like Zoom presentations like this one, and through social media where we try to post regularly. Our blog also posts with information about what's going on with the work, with Nicaragua, and with issues around poverty, climate change, and our faith. We met our fundraising goal for Giving Tuesday, enabling us to move forward with establishing a digital medical record-keeping program and its tools needed for the clinic. With climate change, we try to save on paper. This program, when it gets completely established, will save 8 trees worth of paper a year. We continue quarterly newsletters that give, borrowing a phrase from PBS NewsHour, a brief but spectacular view of the CDCA and its projects. And the project of Casa Ben Linder, designed not only to provide hospitality to those visiting Managua, but also space for art, for entertainment, for worship. And you've given for that work. You've given money to help the murals continue. It's not only expanding the murals, but also refurbishing the original ones that are there. It's really gorgeous. And it's there to provide solidarity with Nicaragua, continuing while enforcing pandemic safety precautions and carrying on education and classes for children, art classes, and those sorts of things, as well as being able to be used by other groups as an open and pandemic safe area to gather. There is much to do to heal the ulcerated wounds that COVID-19 uncovered and to heal our climate. The World Bank estimates that the pandemic will push 150 million people into extreme poverty this year due to economic instability. And by 2030, just 9 years from now, 132 million more people due to climate change. Extreme poverty is defined as living on less than $1.90 per day. Your help continues to be needed. There is much to do. As we look worldwide at the ulcerated wounds that need cleaning on behalf of those in poverty, how can anything that one person, one church, one group do to make a difference? Well, for example, in sustainable agriculture, subscribe to receive a monthly amount of organic coffee from farmershares.com. for yourself or as a gift or for the congregation to use when you begin to open back up. Sustainable economic development. Make a gift or loan to the Vita Fund, which provides revolving loans for Coprex cooperative farmers. Education. Give to provide a month of internet service at the clinic so that health and disease information can go out to Nueva Vida patients over WhatsApp and Instagram. In health, a woman can have safe family planning for 3 to 5 years with an implant. Climate change, donate to switch the CDCA's office and the Nueva Vida Clinic to solar power. Good for the earth and good for the clinic's ongoing operational funding. You can make a difference. You are making a difference. I am delighted to be here with you today to say thank you for how you are helping and to show you what you are helping to do for God's people around the world. Together we can continue and begin to clean those wounds. Thank you.
Thank you, Sarah. It's great to see some new pictures and shared new information, and to hear hope in the midst of all the challenges that we face.
It was a great presentation, I thought. In fact, it really opened my eyes, being the first time I've seen something like this out in Nicaragua.
Well, you all get vaccinated and come on down. Then we'll show you in person.
We're ready. We're getting
Love
ready
to do
go.
that. Love to do
We are
that.
definitely ready.
I thought the $2 a day poverty level was a very, or $1.90 actually, but that's a significant statement. And for 150 million living in poverty and another 132 million more due to climate change coming just in the next few years it's an amazing number. It's
Those are United Nations numbers, World Health Organization, United Nations numbers.
And I'm sure Nicaragua is probably taking out all kinds of loans and probably becoming one of the countries who are going to be in trouble with those loans at some point. If we had a discussion in our morning class about food insecurity, and it was mentioned that one of the things that we as government citizens could help I guess, encourage our people to consider a rich government like ours to maybe forgive some of those debts and hopefully help the countries that way in terms of giving back. So that's something we could all advocate maybe in a way of helping from a political standpoint.
The farmers who belong to Coprex Inc., who are part of the organic cooperative, they have the benefit of having US and European buyers who believe in small farmers and believe in organic farming that's good for the earth and good for the farmers. And so they are very good. Our middle, you know, what do we do in the middle? I'm not obviously not there planting sesame. So what is it that we do? We are the middle people to say, yes, the farmers are still trying. Yes, they're still on board. They didn't get rain, or they got too much rain, or this is what happened with the hurricanes or whatever. Please hang in there and trust the farmers to come back again. And 20 years ago with Hurricane Mitch, the US buyers for the sesame and the peanuts, they lost everything. It was at the end of the growing season, and all of the crops, the sesame that was even already processed in bags ready to be shipped was lost. It was all flooded and destroyed. And they had, I've forgotten what the number was, but it was like $13 million or something like that of crop that they lost. And by all rights, those buyers in the state should have said, okay, so your farms are ours. That's your collateral. We now own your farms. And they didn't. They said, we don't want your farms. We want your sesame. We want your peanuts. So dig yourselves out of the mud, clear the garbage off the top, plant again. And it took 7 years, but every time a container went out to those buyers, a percentage of the container price went to pay off that debt. And these dirt poor farmers farming, you know, with the oxen in the field, paid off that enormous loan in seven years. But they belong to the cooperative and that had this relationship with buyers. Small farmers across the country who've lost stuff is just gone. And so one of the things that we were part of, both ourselves and also our local Rotary Club, was getting the bean seed out to people who were hit the worst to quickly plant while there was still moisture in the ground to try to get food crops to tide them over. And the government is also providing aid to tide it over. And the government's got no resources and they're just doing it anyway. They're just absolutely doing it anyway, because that's what folks have to have. But, you know, we are anticipating these kinds of storms coming more frequently, and we are anticipating them being stronger as climate change continues to affect Nicaragua in this little fragile isthmus between the oceans here. We get the weather from both sides. So yeah, forgiving the international debt would be huge. Forgiving the debt to US small farmers would also help. They need the help too.
Are there any volunteer organizations from other countries allowed in yet?
Everybody's allowed in. The restrictions on coming in are that you have to have a 72-hour before you land negative COVID test on paper. So for example, American Airlines is now flying here because they fly out of Miami. And because Miami's a hub, they can pick a crew that has just had their COVID test for that week and put them on that flight, and they come down, they unload, they're here for a couple hours, they fill back up, and they fly back to Miami, and their 72-hour COVID test is still good for coming back into the US. Whereas Continental United comes from Houston. It's not as such a hub now that they've combined. Houston is no longer their main hub. And they come down and they land in the evening, have to stay over and go back, and they don't have any way to get the 72-hour negative COVID for their crew, So they cannot bring the flight in with the crew who needs to stay overnight and then have a 72-hour valid test for the crew to get back into Houston. So Continental United hasn't been flying since March of last year. And that's huge. That is just huge amount of loss of tourist revenue. So nobody's keeping anybody out here, but prevention is the key to those low numbers that you saw on the bar graph of Nicaragua and this pandemic. And they don't want it here. So you've got to be able to show it. Now I'm hoping that we can put some pressure on Continental, on the government or whatever, to do some kind of electronic, I had my COVID test, I've had it every week, and here's the results for the last month for the crew. Let us go ahead and fly, even if passengers still have to have the paper. But we don't know if that's gonna change or not. But like they can't come without it. So Avianca flies in internationally and American flies in internationally, but the others don't come in, and it's those kinds of reasons. But on the other hand, people here aren't dying.
Yeah.
So you really can't say no to that, but it's really hard on the economy when there's no touristy stuff. Yes, I see your hand, Robert.
Do you think that they will begin allowing people in who've been vaccinated?
I don't know. This is all brand new. One of the things that the CDC has not said, we're still hearing that you can be vaccinated and still get the disease and still be a carrier. So that wouldn't affect whether or not you have a negative COVID test in terms of bringing it here. It would affect whether you get sick or badly sick. You get your flu vaccine, you can still get the flu, you just don't get it as badly. Well, when everybody's vaccinated, then that's an okay thing. But until everybody's vaccinated, that's not okay yet. So I don't know how that's going to time. We are hopeful that those kinds of things will get worked out a little bit in the next couple of months with the vaccination starting here. But, bureaucracy, the wheels move slowly sometimes. And this nation has every reason to be cautious. So we'll see what happens with that.
What other questions do folks have tonight?
I guess one that I would have to do with climate change. And, there's a lot of talk about how we're going to have a redistribution of people one of these days as a result of climate change. And is the government looking ahead long-term in terms of, both either immigrating to other countries or figuring out how they're going to solve this problem long-term, because it's not going to get any better. And sooner or later, countries are, like particularly Nicaragua, because of the location, should be one of those countries that starts that thought process of handling this situation?
In reality, I don't know specifically in response to your question. I don't know anything about that, except that Nicaragua is one of the countries appealing to international organizations. I think it was the Organization of American States, but I'm not really sure which meeting it was, saying that countries like Nicaragua, Nicaragua is the fourth most impacted nation from climate change worldwide. I don't know who makes up those numbers or where they get them from. Those are not our numbers. Those are, science people's numbers. But for countries then like Nicaragua, who are not the big carbon polluters, we have a huge percentage of our energy is generated by renewable resources here. It's like 80%, 85% or something like that now. I mean, it's enormous. And that kind of thing. But we are being impacted by all the wealthy carbon producing nations. And so the idea is to say, we need reparations because these poor nations that are not damaging the climate and the environment need help surviving the damage that's being put on them by the wealthier nations. And so I think, like, for example, there's no irrigation for all these small farmers. There's no way they can irrigate. If it doesn't rain, their crops die. If it rains too much, it floods away. They have no alternative. So right now, Nicaragua produces almost all its own food. But if crops keep getting destroyed every year, then how do you feed your people? And that's the kind of place that I think the focus is being put is how can we get help from the countries that are causing the damage to help us fund what we need to do here to prepare for and deal with the damage. Now, that doesn't have to do with the migration of people, but it has to do with the protection and the caring for people that are at least here. Whether that goes anywhere or not, I don't imagine that anybody's jumping up and down to pay for that, but I do think it's a valid point, I have, before I lose you here, I have one specific brand new need that I would like to put on your heart and mind and prayers, please. Well, actually I have two, but one is really urgent. We have, what do you call the machine that analyzes blood in the lab? Hemographia, something, I don't know. The thing that you stick the strip in and then it says, these are all the different things and components in your blood, that thing, hemolyzer, that machine. Anyway, we have a perfectly workable one in the clinic that our lab knows how to use, and it uses reagents. You can't buy the reagents anymore. Nobody is selling reagents because everybody's gone to the auto machines that just spit out the digital readout, right? So we've been looking for a new machine, and the cheapest machine that we can find here is $6,500. And without that machine, our lab tech cannot do all the blood testing that she's been doing for our patients at the clinic.
And that's for like CDC blood panels, the whole complete.
Yeah. You go and you get your blood work done, and then the doctor looks at it and goes, oh, this is your infection. That thing.
Okay.
It's that machine, and it's $6,500, and there is nothing to do but to bite the bullet, and we need to buy it, and we don't have any budget money for that. So that is a specific need if you know of folks who might be interested in that particular kind of need. And this can be any help towards it, and every little bit helps towards it. The other thing that we are in the process of with this digital record keeping system for the clinic is we are now at the stage where we now need to look for an engineering person who can do most of the work remotely, but to maintain it, and it has to be hosted in the cloud. And we're looking at probably a $300 or $400 a month kind of outlay for that. That's in addition to internet at the clinic. But what it will mean is that our doctors, when they're doing a home visit or going up to the coffee cooperative or, like that, can pull out their tablet and have the patient history right there on their tablet. Oh, I was here 6 months ago and this was going on with this person. And we tried this and now look, it's worse or it's better or whatever, right there at their fingertips. And then when they get back to the clinic, it syncs in the cloud and updates that person's record so that it's there again. It can also be used for everybody coming into the clinic instead of printing pieces of paper over and over and over again every day for every single thing that happens at the clinic. But we've now, it's almost, hopefully in the next 2 weeks, we will be actually looking at a downloaded, let's try this out and see how it works. But then we have to find an engineer who can deploy it. That's the word I'm looking for, who can deploy it and get it set up here and make sure it's all good to go before the volunteer group that has created it for us. They have given us 7 months of development and free service to set this thing up. And before they turn it over to us completely, we have to have who's in place to make it keep on working. It should never break and then there's no problem. But you know what happens when the internet goes out and then suddenly something glitches and you need somebody who knows how to find the glitch and fix it, who can be on call to do that and who can continue to host it in the cloud. So we're looking for those 2 particular needs right now that aren't really kind of, part of the budget, but there they are. But we'll save lots of trees and lots of paper and lots of time and make our home visits and rural visits so much better at the clinic. And everybody will have access to the information. It also means that at the end of the month, when you're sitting there tallying how many people had hepatitis, we're seeing for hepatitis this month, we don't have to do those anymore. It'll just be a search of the information that's already there from the doctors.
Sarah, is there a dollar amount for that one? And for that?
The people who are developing it are estimating that the hosting it in the cloud is probably going to cost about $300 a month. We really have no idea what we need, what we're going to have to pay for a technician. We would love it if we had a volunteer. I have a job description written. You want me to send you the job description, Robert? You can pass it around and see if anybody has any ideas. We don't think that the person who's going to keep it ongoing in the cloud has to be here, because Lihio, who's our dental assistant, is working with me to develop it. So she understands the software on the tablet. What do I do to get out of this? My Windows Office is stuck. Oh, well, hit enter, Control-Alt-Delete 3 times and you'll be good to go. She can do that part. She just can't keep it going in the cloud, but that person can work remotely. So what if we had a volunteer, that would be fabulous. If we don't, then, somebody who could give some of their time or something and see what happens with that. But I can send you a job description and you can pass it around, see if anybody has any bright ideas. But
That person have to be Spanish speaking?
It would be better if they were, but I don't know that it's as critical for them to be Spanish speaking. If they're willing to do, Zooms where we have Spanish translation in the middle of it.
Just out of curiosity, now I know the Gates Foundation does some of that. You've probably looked into that type of thing, or have you?
We've just now gotten a job description ready to send to somebody. We haven't gotten as far as that. We're so little. It's really hard to get past the front door.
Got
because, they're busy, curing polio or something big, and we're just really tiny. But what we're looking at is we raised the money that we needed for Giving Tuesday to get it started. So we can get it started, but then it's going to be this ongoing need of the monthly cloud service and the technician whenever we find whoever this person needs to be. So we have a buffer of a few months to figure this out. But it will be something that, then belongs in the budget from then on. It's just not there yet.
Sarah, we recently had some extra resources that we were able to share with you all. It was a $5,000 gift. Do you have any idea how that was used?
It was used to pay staff salaries.
Okay.
We have been so grateful. We have been absolutely so grateful because we meet every Monday and look at what's in the bank, what's designated that we have to protect for the designated stuff. And, you know, what are the needs? And we haven't, in this whole business with COVID, we haven't had to lay off anybody. We haven't had to fire anybody.
That's great.
And that's just remarkable. And it's because of people like y'all. I mean, it really is. We say we're down here doing this thing and you all are been partners with us. And I say this to people in the US and I don't know how to make you believe it in your gut. We can't do anything here without y'all there. And we are so grateful. But that really is where it went. It went to pay staff salaries.
Back to that piece of equipment you were mentioning, could you send me a link to something that would help us understand what that piece of equipment is exactly? Do you have anything online that you could share with
Yes,
me?
I can. And see, it used to be that we would say, well, if we could get in the US, it could go on a container and it could get down here. But that's not happening now.
Can't do that now.
But
So,
what
and we
I'm
also-
thinking is if I have a way to explain to people what the need is, they're much more likely to be
Sure.
interested in giving.
Sure, I'll get you.
People that are getting, there are people here that are starting to get another round of stimulus checks. And some people are saying, I don't need this. I would like to share it. And most people are doing that locally, but I don't see any reason why we couldn't invite people to share that globally.
That would be great. That'd be great. I can get you what it's called and I can get you this is the one here that we found that we can buy. So you can actually see the make and model and what it does. Yeah. So I'll send you that and I'll send you the job description for the engineer thing, for the digital health thing. And you've got this recording, so it has various links and things in the recording as well to help.
So there won't be a specific designation on your website.
If you give on through the Network for Good, there's a place where even if it doesn't say, like I think solar energy, for example, is a link, is a drop down. You can pick for solar energy to get us the solar panels on the clinic that we're working on. But if it's not, you can just write it in, you know, for the blood machine at the clinic, even if you don't know what it's called, or for the electronic health stuff.
Okay.
And you can just write in like a comment, like you would say, you know, this is for my mom in honor, an alternative gift for my mom's
Yeah.
birthday.
That's what I'm looking. There's healthcare, Nicaraguan staff, solar, COVID.
But then there's also a place you can do comments kind of
Yeah,
below
I
that.
want my donation to be dedicated.
And
So,
you can put anything you want there.
Okay.
And then we check those and use it for them. And we're very careful.
or
about it.
other dedication, that's at the end,
Yeah.
or designation. Perfect. Okay.
You can use that.
Well, thank you so much for spending this time with us. Are there any other questions before we close?
Thank you for setting this up.
Thank you so
Hey.
much.
Those are my in-laws, Sarah.
Oh, hello,
Met my
in-law.
wife, Jenny, those are her parents.
Hello, I'm sorry. I had to run Claire to youth group.
That's all right.
Pick her up.
Robert's has got this recorded, so you can suffer through the recording if you want.
Oh, thank you for being here tonight.
I am just delighted. I hope I get back to see y'all in person spring of 2022. That's my goal. I have a goal for this.
That'd be
We'll see
wonderful.
if I
I have
get
a goal to get down in there before you get back up here.
that. I like that. I like that goal. Let's do that. Thank
Well,
you all so much. Please.
Everybody have a lovely
everybody
evening.
there.
Que
Thank you.
Dios te bendiga.
Thank you.
Thank you, Sarah. Thanks everybody for joining.
Good night.
Good night.
Hope, we'll follow up and see how we want to roll this out to the congregation.
Perfect. Sounds good.
Okay, great. Have a
Thanks.
good night.
Night.